All right, Dr. Emer, we are live.
I'll talk to you about that in a minute. Not really fast. Hey guys, it's Dr. Emer. We're doing Halo. We're actually going to do a combination of Halo and CO2 today. We're doing Halo right now. You can see I've done it in other areas. This is one of our favorite fractional lasers. I use it for rejuvenation purposes, pigment, wrinkles, anti-aging, sun damage. We're also doing it here for enlarged pores and for just improvement in overall texture and tone. You can see the erbium device with the little dots here. We're doing a really aggressive setting because we want to work on the superficial part for his pores. We're going to do a CO2 on his nose in a minute, but we're doing the combination fusion device on his cheek area, forehead, and the rest of the face, which is both the deep laser and the erbium superficial laser. That's why you can see some pinpoint bleeding because it's going to improve the deep texture and superficial texture. The goal is that all these little dots heal, and then sort of the next week he'll get improved skin. But over the next 6 to 12 months, collagen will build from the 1470, the red part of the laser that you can't see here because it's infrared. What are they saying?
All right, let's see. People are telling us where they're from. We have some people someone's asking, what city are we in? We're in West Hollywood, California, United States. And later this week, we'll be in New York. Next month, we'll be in Florida.
So you guys can see, this is pretty aggressive. Look over here where we did before, it's bleeding. We're doing a strong setting because I really want to get quality of his skin improved. He hasn't done a laser in a long time. And now remember, you guys, I've done a strong laser on my face every 3 to 4 months since I was 27. So my pores are like non-existent. That's because I'm doing lots of peels and lasers consistently. If you have very porous skin, you really need to do a lot of non-ablative lasers consistently. Otherwise, the pores don't really shrink permanently. So this is the start of that process and giving him just improved quality of skin. That's what we want.
What kind is this? This is our Cyton Halo laser right now. It's the hybrid fractional laser. Right now we're firing 2 different wavelengths as we go over the skin. You guys can see all the little white spots on the skin. Each time you hear that pop, that little crackle, it's making a new spot on the skin.
Exactly. So that will peel and new skin will fill in. And improved texture and quality is going to occur.
Dr. Emer, can you do this for dark skin?
You can actually, but you have to do it very light. So if you have scarring, it's not going to be sort of practical. You're really not going to get a great result. If you have just pigmentation and want some anti-aging, peels mixed with this will really help. You got to consult us. Tell them how.
Guys, any consults, any treatment questions, if this is the right treatment for you, you guys send us a DM, full name, email, phone number. We'll reach out to you. We'll get you in a consultation. You can talk to Dr. Emer or one of our specialists.
It will be in New York on Thursday. I think it's already full booked to January. But if you want to contact us, we could try. Boca in December, you guys. I would love to see my patients from in and around Florida. And then his treatment should be this again in a couple months. But he could even do in 4 to 6 weeks microneedling, peels. My Aerify mask could be started immediately to improve the outcome. He could always do it in a week when he peels. There's a lot of options. Dermatology should start in about a week or 2 to just improve the quality of the skin. We're almost done on this side. You see we're pulling down so we can get as close to the eye as Halo will allow me. Typically we'll do, if we want to improve the eye itself, we'll do another laser like CO2 there, or for fractional, or even plasma pen. You guys know one of my favorite new treatments.
Can we tell them about the downtime of this laser?
Well, this is going to be about 5 days, 3 to 5 days of peeling. The good thing is you only look kind of like speckled. You don't really need to stay at home as much. You guys can see my Innovative Optics glasses from Innovative Optics. I love this, really covering the eye, keeping it protected, but allowing me to still laser on all areas. Turn right a little bit more. Perfect.
What effect will this have on melasma?
This is not the best treatment for melasma. Tell them to consult us and how, because I have a lot of people writing in about this for melasma, and you can do it at very low strain, but you still need to do peels and other things. It's not going to be good if you have melasma and scarring.
If you guys need a skincare consultation, you can send us a DM, full name, email, and phone number, or you guys can go to emeragecosmetics.com where you can get a virtual skincare consultation on there with one of our specialists.
So you guys can see, I mean, very thorough, covering all areas. Lots of little dots being poked into the skin. Last pass. Final pass. And then we're going to go to the nose. So we're going to treat this similar to rhinophyma, where we do a strong treatment, and then we do a second pass. It'll take a little bit longer for his nose to heal.
So it's just like resurfacing?
Say that again. This is resurfacing. It's laser resurfacing. Yeah. Okay. So now, we're going to switch. You guys can show the skin. Show the skin. Yeah. These should be pretty numb.
Alright, you guys, ask our questions. Guys, we just did our halo, guys. Suppose you asked about CO2. The CO2 is up next. We are going to do our patient's nose here for the pores. Let's see, guys, if you have some questions, ask us about what we're doing. If you have skincare questions, let us know. Right now we are getting ready. We are going to do a CO2 spot treatment on the nose.
So here's the thing. I'm going to take this down from you a second, then I'll get this back. Okay?
How long do the results of this treatment last?
I mean, I tell people, remember, every 3 to 4 months, you're doing a stronger laser to keep anti-aging.
What is the benefit of combining this with CO2?
We're not combining it. We're doing his nose separately because we want a stronger treatment. I'm going to do a spot treatment first. Spot area. You're going to feel a little bit, okay? Now, this is going to allow me to get a little bit more penetration onto his skin. His skin's thicker here. And we're going to treat it almost like a rhinophyma. What does that mean? That means when the skin thickens on the nose, a lot of it has to do with sebaceous glands. And the sebaceous glands are deep. They're not really superficial. So to improve them, you really got to get a lot of deep heat. That's why I actually really like CO2 over an erbium laser on the nose, although you can do erbium contour, which is fully ablative. This is not fully ablative, this is fractional, but we're going to do a second pass. I'm going to need a little bit of wet gauze. I'm going to show you guys in a second what we're going to do. I did this before on TV. I've shown this before on a show called Botched. When a girl had a damaged nose and we had to fix it a little bit. I'm going to do a little blending here on his upper lip to get everything kind of just blended through here. His skin's a little thicker around here. So now what we're going to do, I'm going to take a little bit and I just want to just kind of lightly see where I am. You guys can see the skin peeling off. It's the upper surface, okay? I don't want to be too aggressive for him because this is more of an anti-aging procedure, but he really does want a lot more improvement in the pores. You can see already, look at that top layer, it just came off. And look how much smoother just removing that top layer. So now that top layer is gone, okay? We're going to be able to do a second pass and get a little bit deeper so that we can get into those pores. Now look, a lot of those pores are actually clogged. So post-treatment, we really need him to do peels and follow up with skincare. And we're going to do a second pass now. Here we go. And then we'll be done. You want to be too aggressive. If someone had really thick rhinophyma, it's a different story. This is just anti-aging. This is blending and improving his quality of his skin. So you can see we're not going to go too much more than this, so the downtime will be too much. But this will allow me really to get a little bit more of an improvement for him than if we just did a single sort of fractional or even one fully ablative. This combination of sort of de-char is what we call it, will improve the overall quality of the skin here and allow it to be much smoother. What are they saying there?
A lot of people are tuning in, don't have a lot of questions right now. Actually, we have one on YouTube. Let's see. What does this procedure cost for the entire face? How many treatments would one need? Guys, the amount of treatments is going to depend on your skin and what your skin needs. To get a consult with us from our YouTube, guys, go to our website, jasonmrmd.com, and you guys can get a consultation on there, and we'll get you the accurate information for your skin.
You can consider this kind of rhinophyma treatment is what we would call it. And again, remember, we're going in a density that's going to allow us to get some deep heating. And that deep heating will shrink the glands and make the skin itself look much smoother. Okay. And then I'm just going to do, again, just a soft little blending. And then what I'm going to do for him, he was saying he wants his under eyes a little bit better. So I went all the way up with the halo. I'm just going to do like literally a fine little, just a little pass, blended halo CO2 to give him just a little bit more. It won't be much downtime at all. Just a little blend here to the under eye. Perfect. So now you guys can see, now we leave the char on. We want to let it heal on its own. I'm going to keep your eyes closed. We want to let it heal, but you can see that that's all damaged skin. And now we're going to apply our growth factors and our stem cells. And you can see here is PRP mixed with the A cell, which is the bladder stem cells, basically. And this is going to allow him to heal much faster. We got to get those into the pores, into the char, on the skin immediately, but you don't want to rub the char off. If you take a look, what's cool is you can see with the halo, that honeycomb look, that's because there's so many little punctures in the skin right now that are all going to heal on their own. Look at the stem cells and the growth factors in there. Those are all going directly on the skin. We have healed burns with this. Really amazing results. And this will help him heal much faster, which is why we do it. And again, you guys can see a little bit more of the stem cells. He's also going to use the Emer skin, all of our products after. And like I said, when he peels, right when he peels, he can do peels. I'll get your eye. I'll get you. Right when he peels off from this, we can start our at-home treatments. So everything looks great. We're going to let him heal. We just did our combination Halo CO2. Everything's great. Bye, guys. You did good. Very good. Now I want you to take the cold air, okay?